everybody, this is Dr. Brian Prax, and I've got some very recent research I have to share with you. This is actually out of the online reference called drugs.com. Awesome article. It's called Osteoarthritis of the Knee Research. The research is actually coming out of Journal of Radiology. Intra-articular corticosteroid injections in the hip and knee. Perhaps not as safe as we thought. What's this all about? Let's go into knee and knee arthritis because that's really what it's really all about. Here's what a normal knee looks like. You got your femur, your kneecap, your tibia, and you got a nice looking joint line. Excellent looking knee. We've got a big joint in there. In a joint like that, what we're looking at here, the space, is what's called the meniscus. That's that white slippery stuff. If you're to take a chicken bone or a turkey bone and open it up, the slippery white stuff, that's cartilage. And that's a beautiful looking cartilage space right there. So on the opposite one right here, you see, wow, we have some serious loss of joint space. That's called severe arthritis, otherwise known as bone on bone. That's a problem. That's serious arthritis. This research is fascinating. It's a little research, but it's not the only one, and that's what drugs.com points out. So there's a building body of evidence, what they point out. But this research, right back in October, was done on 459 patients. And what was fascinating with this is these are patients who received corticosteroid injections, knee injections, right, in either their hip or their knee. And of these 459, what they found is that 26 of them, 6%, which is actually a lot, showed a quick progression of their knee arthritis. What? So the injection caused a quick projection, like it got worse fast. Another one, 3 patients actually suffered rapid joint destruction, meaning a pretty decent amount of these patients, a pretty decent percentage, their knee arthritis got worse even faster. And then the last one is 3 of them had complications from osteonecrosis. Necrosis, that's bone death. Yeah, so at first do no harm is what I think about. That's the Hippocratic Oath. So if doctors are recommending steroids, steroidal injections, they should be telling you about what the possible side effects are. Bone loss, also known as osteoporosis, osteoarthritis, worsening of joint arthritis. It wears away the tissue. We know that it wears away the tissue that it's injected into. Osteonecrosis. This is leading to stress fractures, in these cases, stress fractures of people in the hip. For those of you who are senior citizens, the leading cause of death in a senior citizen is a fall and breaking a bone. Wow. Now what's really interesting about this article is it says on average, the complications were detected 7 months after the injection. 7 months. Who's going to look back 7 months ago and say, gee, I wonder if your fall or your hip fracture or your quickly degenerating arthritis in the hip or knee, gee, I wonder if it was from that injection we did 7 months ago. Not going to happen. They're not going to point that far back. They're going to say, you're getting older. That's just what's happening. This arthritis is bad. And guess what? You're going to need a knee replacement. Wow! Now you need a knee replacement. A lot of these are from problems that are accelerated from injections. I just want you to know this research. There's more research though. This goes a little farther back. This is 2017, 2 years back. The JMA, Journal of the American Medical Association, very well respected journal. Hip, knee arthritis patients who received repeated injections over 2 years with either corticosteroids or a placebo. They compared. Watch this. Patients given steroids typically saw no pain relief and instead showed a faster progression of cartilage breakdown. Once again, that's the cartilage, the meniscus in between. So injections are speeding arthritis and breaking down the cartilage, the meniscus, leading to arthritis, which then doctors are saying, well, looks like you need a replacement. The injections are leading you there faster. There you go, Hippocratic Oath. At first, do no harm. Wow, at least your doctor should be letting you know about this, okay? So now they go on to say that there's no known cure for osteoarthritis, and treatment involves managing the symptoms through weight loss, exercise, they kind of just toss those in there, non-steroidal anti-inflammatory drugs like Tylenol, ibuprofen, naproxen, injections of corticosteroids, which reduce inflammation, are another option. So at first do no harm, they're doing harm. And that's what these two articles, there's plenty of other articles that talk about it too. And then they just kind of threw this in there as well. Now, you can't underestimate the importance of weight loss or physical therapy. That's where it's at. Prevention is key. If you're at the point where you can't prevent, then do the best you can. I want you to look up this technique called Trigenics, and I'll put some links in there. I got my link, I got my video, I got the Trigenics. Just look up trigenics.com. It's phenomenal. That's not what this is about. This is about what you need to know with corticosteroid injections. So I hope that helps out. Do your research, ask questions. Not everything is as safe as it seems. Hope this helps. Leave your comments below. Love to see those comments, and we'll talk soon. Thank you for watching this video. If you like the content, I would ask you to hit the thumbs up button to like it. You can share it with a friend, subscribe to my channel, and please comment below. I will read it and I will respond. Thank you and have a nice day.